Hi, I'm Dr. Duke. Having a hamstring injury is devastating to runners. And most of the athletes I know, when they are injured, rest is simply not an option. So our skill set from treating many Olympic athletes over the years translates over to our general practice. And today, I'm going to show you how we use an innovative technology called EPAT, radial shockwave therapy, to help take a hamstring that has rips and tears to it and actually help it heal and regenerate. It's called regenerative medicine. This is Melissa, and she is a local runner here in New York City. She recently had a PR in California at a marathon where she nearly broke 3 hours. She was right on the cusp. Anyway, following the marathon, she started having some upper hamstring problems, and then MRI showed that she has upper hamstring tendinopathy, some tendinosis, scar tissue infiltration, and some rips and tears. So shockwave therapy is something that we're going to use to deliver a pressure wave into the tissue that's much deeper than what my hands can do. And we use Graston instruments and active release technique and physiotherapies, but when we combine it with the radial shockwave, we really get dramatic results. All right, Melissa, are you ready?
Yes.
Okay. So typically we deliver anywhere between 6,000 and 9,000 pulses per session. Right now I'm just going right up the hamstring until I feel where the injury is, and I can feel it right now. And what we're trying to do is burst the scar tissue, literally destroy it, so that way it creates an analgesic effect by resetting the pain pattern, and then new blood vessels will form that will help regenerate the tissue so collagen can get in there, and then elasticity is restored as well. Let me have you flip on your back. You can't just treat the hamstring in that prone posture. You need to add a little elasticity to it. All right, so now I'm going to get right over that ischial tuberosity. That's the area where it attaches into the bone. Yeah, this is a tough area for most people. But again, this is the area where the upper hamstrings tend to connect. And that's your attachment site. Now bend your leg for me. Great, hold it just like that. Lie on your side, face that direction. We also can't just treat the hamstring, you have to treat the muscles that surround the area, and that's the hip. So we find, with our palpation skills, the piriformis muscle, that's a hip rotator. And again, it's called compensation, because as soon as you start running and muscling through things, other muscles start to get short and tight, and then it compensates and then throws off your gait as well. And then we pay attention to not only the piriformis, but then some other muscles of the hip called the obturators. And back down again. I'm Dr. Duke. Watch the rest of our videos and see how we treat many injuries with different modalities.